This is the most commonly caught catfish in the United States. 8 million anglers fish for it every year. It is the state fish of 4 states: Kansas, Missouri, Nebraska, and Tennessee. It has been swimming in North American rivers for nearly 20 million years, with fossil evidence of the species recovered from geological formations across the central part of the continent dating to the Miocene. The channel catfish is as ordinary as freshwater fishing gets in America, and for generations, the injury it inflicts when handled incorrectly has been dismissed as a minor inconvenience, a poke, a prick, a brief sting that fades in minutes. What the peer-reviewed medical literature says about that injury is considerably more serious. The channel catfish, scientific name Icatularis punctatus, from the Greek and Latin for fish cat and spotted, is the most fished catfish species in the United States by a wide margin. An average adult runs about 12 inches long and weighs between 2 and 4 pounds. They are identifiable by the deeply forked tail that distinguishes them from bullhead catfish, and by the small dark spots scattered across their olive brown to slate blue sides, which often fade in older adults. The IGFA all-tackle world record stands at 58 pounds, caught by W.H. Whaley on July 7, 1964, from Santee Cooper Reservoir in South Carolina. That fish measured 47¼ inches long with a 29-inch girth. It was landed on a Bronson rod with an Atlantic coast bucktail jig. The record has stood for over 60 years. Channel catfish range from southern Canada to northern Mexico, native across almost all of the continental United States between the Appalachians and the Rockies, and introduced to 28 additional states, Puerto Rico, and at least 38 countries worldwide, with populations now established in England, Italy, Spain, Portugal, Brazil, Japan, and throughout much of Europe and Asia. They are one of the most widely cultured food fishes on Earth. They are caught on essentially anything: chicken livers, worms, cut bait, stink bait, cheese, hot dogs, grasshoppers, marshmallows, artificial lures, as the world record itself demonstrates. They fight hard for their size. They taste excellent. They are the everyman fish of American freshwater angling, the fish that introduces more Americans to fishing than any other species. They are also the fish with the spine injury that most anglers have had at least once, that most anglers have been told is harmless, and that the emergency medicine literature describes as capable of producing outcomes ranging from simple puncture wounds to sepsis, surgical intervention, chronic infection, permanent tendon damage, and in documented cases, bone damage that persists for decades. The misconception and what is actually true. Ask most anglers whether channel catfish are venomous, and a majority will say no. Ask a slightly older generation, and many will say the whiskers sting, stated with confidence by people who have been handling catfish their entire lives. Both answers are wrong, in different directions. The whiskers do not sting. The barbels around a channel catfish's mouth are sensory organs packed with taste buds, used to detect food in dark or muddy water. They contain no venom apparatus of any kind. On this point, every source, from state wildlife agencies to the peer-reviewed medical literature, is in complete agreement. Where the science becomes less settled in the popular conversation is the question of the spines. The Wikipedia article on channel catfish, which most American anglers will encounter if they search the species, contains a statement that being pricked by a catfish spine is no more dangerous than a sting from a mosquito. That line should give any careful reader pause, because it is directly contradicted by the same Wikipedia article elsewhere, which describes the spines as injecting venom. It is also contradicted by the peer-reviewed medical literature, by emergency medicine case reports going back to 1994, and by the clinical experience of hand surgeons who regularly treat catfish spine injuries. The medical literature is not ambivalent on this question. A 1994 paper published in the Journal of Wilderness Medicine explicitly lists the channel catfish, Icatularis punctatus, among the ictularid species most commonly responsible for dangerous catfish envenomations. A 2013 case report, published on PubMed Central, using a channel catfish spine injury as its central case, states directly that the spines of all ictularidae, including Icatularis punctatus, contain venom glands that release venom capable of causing severe local inflammatory reactions and possible systemic symptoms. A 2017 literature review published in Wilderness and Environmental Medicine includes channel catfish on its list of venomous North American catfish species. The same review notes that catfish are the most prevalent poisonous fish in North America, accounting for approximately 90% of freshwater aquatic injuries. Channel catfish are venomous. That is the position of the peer-reviewed medical literature. The venom itself has been characterized across multiple studies. It contains hemolytic factors, which break down red blood cells. It contains dermonecrotic factors, which destroy tissue at the site of envenomation. It contains edema-producing factors, which cause the characteristic swelling. And it contains vasospastic factors, which constrict blood vessels in the area of the wound, a property with significant implications for infection risk, which we will come to in a moment. A second source of toxins, called crinotoxins, is released by the epidermal cells of the catfish's skin when the fish is agitated, coating the spine before it enters the wound. The result is that a channel catfish spine puncture delivers a mechanical injury, a chemical venom injury, and a toxic skin secretion injury simultaneously, in a single strike, in the half second it takes for the fish to react to being grabbed wrong. The channel catfish carries 3 spines, one at the leading edge of the dorsal fin and one on each pectoral fin. When the fish feels threatened, it locks these spines into a rigid, fully extended position through a mechanism in the pectoral girdle that holds them outward against considerable force. The locking is effective enough to make the catfish physically difficult to swallow, which is the original evolutionary function. The spines of the channel catfish are described in the peer-reviewed medical literature as sharp and deeply serrated. The serrations matter. They increase tissue damage as the spine enters. More importantly, they carry a feature called a retrorse barb, an upturned tip on each serration that faces back toward the fish's body. What this means in practice is that the spine enters the skin relatively easily, but cannot exit without doing more damage than it did on entry. The barbs catch on tissue. They resist withdrawal, and in the half second the spine is in motion, driven by the thrashing of a frightened fish. The geometry of the barb means the spine is more likely to migrate deeper into tissue than to back out the way it came. This is the part most anglers do not know. The spine does not simply puncture and stop. In a 2018 case reported by University Hospital's Cleveland Medical Center, a catfish spine was recovered from deep within the lumbrical muscle of a patient's hand during surgical exploration. The spine was approximately 3 centimeters long. The barbs had advanced in a proximal direction from the original site of entry, meaning the spine had moved through the hand away from the entry wound, driven further in by the fish's thrashing during the original injury. The patient required full surgical release of the flexor retinaculum and the flexor tendon sheath of the small finger before the spine could even be visualized. He was discharged on a 3-week course of triple antibiotic therapy. He returned 3 weeks later, unable to flex 2 joints in his finger. The tendon had ruptured. He required a second surgery. The other significant problem with the serrated structure is detection. Catfish spines are radiolucent, meaning they do not reliably show up on standard X-ray imaging. A spine fragment embedded in a patient's hand or foot may require ultrasound or MRI to locate, and in some cases is missed on multiple imaging studies before finally being identified. In one documented case described in a 2017 literature review, 2 catfish spines remained lodged between the metacarpals of a patient's hand for 13 months before being correctly identified on imaging. The first surgery removed 1 spine. The patient's symptoms did not fully resolve. A second surgery, 3 months later, removed the second spine, but the patient's symptoms still never returned completely to baseline. That is, a patient who carried 2 catfish spines in their hand for more than a year, underwent 2 surgeries, and did not make a full recovery. Another case documented in the same review concerned a woman who presented for a routine bunionectomy. During the surgery, an incidental bone cyst was discovered in her foot. It required 11 months of casting, physical therapy, and electrical bone stimulation to heal. She could not recall any recent injury. What she eventually remembered was a catfish spine puncture she had experienced 25 years earlier to the same foot. The initial pain from a channel catfish spine injury is immediate, sharp, and throbbing. It may spread up the limb. In most cases, the pain itself fades within 30 to 90 minutes, helped along considerably by hot water treatment, which denatures the heat-sensitive venom proteins. But pain is not the primary clinical concern with these injuries. The infection risk is catfish live in freshwater that contains Aeromonas hydrophila, a gram-negative bacterium ubiquitous in warm freshwater environments across North America. Aeromonas is not exotic, it is not rare. It is in the water of nearly every river, lake, and pond in which channel catfish are caught. Under normal conditions, it causes no problems because it requires a wound to enter the body. A channel catfish spine puncture is exactly the kind of wound it requires. An otherwise healthy man in his early 40s presented to an emergency department with sepsis and rapidly spreading cellulitis shortly after a catfish injury at a freshwater lake. His blood cultures grew Plesiomonas shigelloides, a bacterium that normally causes bacteremia only in immunocompromised patients. He required intravenous broad-spectrum antibiotics, eventually narrowed to ciprofloxacin once the organism was identified. A 52-year-old man presented with 10 days of arm swelling and redness after a catfish spine puncture to his thumb. His wound cultures grew Proteus vulgaris and Morganella morganini, organisms documented in catfish injuries in only one other reported case in the entire medical literature. He was hospitalized. He required incision and drainage of an abscess. The literature on catfish spine envenomation infection includes, across multiple reviews, a consistent list of pathogens: Aeromonas, Vibrio, Pseudomonas, Mycobacterium marinum, Klebsiella, Enterobacteriaceae, and in rare cases, organisms that are almost never otherwise associated with freshwater injuries. The vasospastic component of the catfish venom compounds the infection risk directly. The venom constricts blood vessels at the site of the wound. Reduced blood flow means reduced immune response, reduced delivery of white blood cells to the area, and reduced delivery of any antibiotics the patient might be taking. This is why emergency medicine protocols for significant catfish spine injuries now include calcium channel blockers alongside antibiotics. The drugs are administered specifically to counteract the vasospasm caused by the venom and restore normal blood flow to the wound site. For a serious catfish spine injury, current emergency medicine practice recommends aggressive wound cleaning, hot water immersion between 110 and 115 degrees Fahrenheit for 30 to 90 minutes, imaging to search for retained spine fragments, tetanus prophylaxis, and empiric antibiotic coverage with ciprofloxacin or levofloxacin specifically chosen for their gram-negative coverage and tissue penetration. Penicillins and cephalosporins are not adequate first-line choices because Aeromonas is frequently resistant to them. Why the small ones matter most. There is a counterintuitive principle in catfish handling that experienced anglers learn early and new anglers often discover painfully. The smaller the channel catfish, the more dangerous the spine injury is likely to be. In young channel catfish, fish under 3 pounds, which is most of what anglers catch in day-to-day fishing, the spines are needle-sharp, fine-tipped, and capable of penetrating skin with almost no resistance. In larger catfish, the spines become blunter, thicker, and harder to drive through human tissue. A 20-pound channel catfish has spines that are relatively dull compared to the needle-like spines of a 12-inch juvenile. The juvenile is the fish that will actually put a spine through your palm. The adult is the one you can handle with less fear. The mechanism of injury also tilts towards smaller fish. Small catfish are more likely to be handled with bare hands during unhooking. Large catfish are more likely to be handled with pliers, gloves, or a lip grip. The smaller the fish, the more casual the handling tends to be, and the more likely the angler is to be reaching directly into the zone of the extended dorsal spine. The channel catfish is not a rare or exotic species. It is not a fish people travel to seek out. It is a fish caught by children on worms in farm ponds, by grandfathers on trot lines on the Mississippi, by tournament anglers and weekend fishermen and aquaculture workers, and everyone in between. The 8 million annual American anglers fishing for channel catfish generate a very large number of spine injuries every year. Most of those injuries heal without incident. A small percentage do not, and the ones that do not can produce outcomes serious enough to require surgery, long courses of antibiotics, and in rare cases, permanent functional damage to the hand or foot. The most important thing an angler can do is handle the fish correctly. Grip the fish from above, hand behind both pectoral spines, palm pressing the dorsal spine down flat against the body. Use pliers to unhook small fish. Use a lip grip for anything too large to hold safely by hand. Never grab a catfish that is thrashing on the line without controlling the spines first. If a spine does penetrate skin, clean the wound aggressively, immerse it in water as hot as is tolerable, and monitor for swelling, redness, warmth, or red streaking, any of which signals an infection that needs immediate medical attention. If the wound is deep, if there is any suspicion of a retained spine fragment, or if the pain fails to improve, see a doctor and request imaging. Do not assume the spine is not inside the wound just because an X-ray came back clean. The channel catfish is one of the great success stories of North American freshwater fish. It is abundant, it is widespread, it is adaptable, it is delicious. It has been pulled out of American waterways by tens of millions of people over the past century and a half, and it has been quietly, consistently, predictably putting spines through the hands of those people the entire time, in injuries most of them dismissed, and in a small but documented fraction, in injuries that turned out to be considerably more serious than they looked at the moment they happened. The small fish at the end of your line knows exactly what those spines are for. It has known for 20 million years.